colleagues and coworkers. Welcome to the Two Bad Nurses podcast. We are your favorite nurses, Yomi Richardson.
Lisa Heath.
Hey, Lisa, how's it going? How was your week?
It's been a real week. It's been busy, but I'm hanging. How's your week?
It was good. I had a good week. I had a discharge that, you work so hard to get these people out on time as case managers and try to, facilitate the discharge. And it fell apart in literally the ninth hour. They decided on a dialysis patient that they wanted to dialyze them the next day. So it just fell apart. But, when you put a lot of work into stuff and then it doesn't come to fruition, it's like, ugh.
I know.
Mm-hmm.
Not fun.
Yeah. So Lisa, I got a question for you. What's your favorite story?
I would have to say there's so many.
No.
There's so many, but I would have to say one of the ones that I can remember.
And see, I didn't prep you.
No, one of the ones I can remember is when, I don't know if you were working the SICU with me, but we had a person that came in a car accident, had multiple injuries, was on a ventilator, and he was from another country. His wife comes in with him and we take her into the room, and about 30 minutes later, someone came in that was his girlfriend. And she said that wasn't his real wife. He just married her to keep her in the country, and she was going in. And she went in and they ended up fighting, and they fought in the room. And when they were fighting, they disconnected him off the ventilator. That they extubated him on accident. And it was it was a chaos in there. Us trying to re-intubate and put them out, and other family members coming in. That's just one, but so many of them. We've had those stories where it's usually girlfriend and girlfriend, wife and another wife, girlfriend. Those kind of family dynamics are what, I don't know if we should even say the name, possibly, but what they brought to the table.
Wow. So I actually did a TikTok on this week, and I was telling the people that we're going to talk about that in depth. And so you're kind of leading up to this episode that we're going to have in the future, in the very near future. But and this one, what was I saying it in relation to? I think it was something that was trending to where, somebody else was married, just like how you're saying. And I was telling them healthcare directives, advanced directives, durable power of attorney for healthcare. And what does that look like?
Absolutely, because those are the things that you have to talk about when you're in there, and what us as nurses are caught in the middle until we can figure out who legally is the decision maker.
Right.
And so when you have different people in there arguing about what to do, you have to have that. You have to have that for us to look at and say, okay, this is what we're following. It is the legal document. So I don't know what, there was one time on a telemetry unit that a man came in having seizures. And when he was having seizures, I could tell they were fake. Mm-hmm. They weren't real. Mm-hmm. But his wife was in there and he was having seizures, and I'd come in and talk to him. His wife would leave for a little bit. He's talking normal. About 2 hours later, this young woman walks in, no shoes on, walks through the unit, and she's looking in the window, and I asked her if I could help her, and she said, "Oh, I'm here to see him. I'm pregnant with him. I was just in the emergency room. This is my sonogram. This is my baby." And she goes up to the window and starts putting the sonogram picture up on the thing. And you know what he did? Had a seizure.
Had a seizure. Had a seizure.
Seizure. So I was like, oh. And so his wife and all them are in there now. So I'm telling her, you can't go in there. So I'm like, where are your shoes? She had called 911 and said she was in labor, possibly early labor. So the ambulance would come pick her up because it's February, 6 inches of snow outside. Mm-hmm. They come take her to the ER. Nothing's wrong with her. Did the sonogram, discharge her. But that was her ride to get up there. Mm-hmm. Mm-hmm. So she started walking around and had no way home. No shoes on and no way home. So she just followed me around all night till I said, honey, you got to go. I mean, we got to figure out a way for you to get home. You know, you can't just hang out with me all day. You know, I'm working and, you know, this patient confidentiality, there's all kinds of things involved. So those kind of situations, again, where you've got two women, you know, a whole family, and this just strange things that happen, you're put in a bind, you're put in the middle all the time. That one was obvious. I mean, he was married, his wife was the person that was in control, but you never know. If he wasn't married and they were just two of his baby's moms, you never know how that would have turned out.
Yeah, and it's crazy. So a couple of things. Ambulance as transportation to the hospital. That you just sparked a memory right there. And how many people would take the ambulance to come in, just wasting healthcare resources on nonsense. And it's like,
Mhm.
gonna call a ride, like, you know, and the people that were coming in were usually surrounding the community. So they weren't coming from very far, you know,
No.
it's Winnetonka, you
Yeah.
know, traveling in from. So that's crazy. But I can't wait to follow up on that more in the once we have that podcast about that.
Uh-huh.
And this one that's trending in the media, the young man is a football player, and the girlfriend announced that she was pregnant, or he announced that the girlfriend was pregnant, and the mistress came out of the closet and just put him on blast. And the sad part about it is, like, he was funding her lifestyle, or was funding her lifestyle, like sending her, if we believe what she said to be true, like $20,000 in you know, sending her money, was talking about, I'm looking forward to paying for your apartment, you know, just sending all kind of messages, and you now blowing that up. So what does that look like for you now? And
Right.
yeah, I don't understand these young women.
No, no. And but that's again your point of the DPOA.
Yes.
That really drove it home, like why you need to make sure you have that,
Right.
especially if you're out here knowing you're not living right. You have a lot of women in your life. You're
Hmm.
doing a lot of things, but you've got to designate one person that's going to be responsible for life and death decisions if you're in a position that you can't make that decision for yourself.
Yeah. I don't think people take it into consideration. So
No, that's the farthest thing from your mind while you're out here living life, you know, you
like,
don't think
young
about it.
people, you young, you know, 20s, 30s, people not thinking anything's going to happen to them. Definitely. They don't even see it.
No,
That's why we're
no.
necessary.
Yeah,
It's-
that's why we're here.
and it's nurses to educate and bring this information forward, because I don't know that, you know, doctors, it takes a nurse. It just takes a nurse to educate the people.
Yes, yes.
The segue into what we're going to talk about for today is Miss Brittany Renner. And so this young lady, she was spotted out on a date with Shaquille O'Neal, and it's literally trending, blowing up the internet. Brittany Renner, for whoever does not know, she is a young woman. She started off as a fitness instructor. So that was her initial kind of debut into social media. And then from there, she segued or became known for who she was dating and her dating habits. But in particular, she was dating a young man. So, per her own admission, so she did multiple interviews to where she was talking about people that she had had sexual encounters with. She was actually given her body count. This is her language, to say, I've slept with 30 men, NBA players. So being very forthcoming about her sexual history and who she was having sex with, not naming people, but that this was the, you know, this is the time that she was on. So she has since, so she was trending in media because of that for a number of years, because of who she was dating. Then she connected with a basketball player, PJ Williamson, or Williams, I believe, and she had a baby by him, and she had made several kind of very candid statements about what it's like to date an NBA player, how they don't engage in protected sex. Nobody likes to use condoms, so just was really spilling the tea. And so this kind of helped her kind of fuel her social media profile. Recently, she came back within the past couple of months, she came back and she said that she regretted how she was presenting herself, the people that she was having sex with. She was giving herself to people that didn't really deserve her, and she linked it to poor self-esteem. And we'll kind of go into her background here in a little bit, but when I was thinking about her, I was like, you know, sexual health. and, the stereotypes that surround sexual health, and just the misconceptions that surround sexual health, the stigma, disparities among ethnicities, and how women disproportionately bear the burden, of sexual health, and, making sure that sex is protected. So I think, just kind of out the gate, what are your thoughts on Miss Renner?
Well, I think that it's good that she's had a change of heart and that she's done a complete turnaround, with, rather than glorifying how many people you slept with and what NBA players and whatnot, that you recognize that you did some things because you didn't have the self-worth and you didn't love yourself. And so I think that that's good for her letting everybody know, because we as women, don't want to shame people for the things they've done in the past, rather educate and hopefully that they change. But as far as the sexual health goes, I mean, I think it's really unfair for the burden always to be placed on women. If you get pregnant, well, you didn't have birth control, you didn't use a condom. I mean, it takes two.
Mm-hmm.
He didn't have a vasectomy, he didn't use a condom, so it's not, it's the world we live in, that the women get shamed for a lot of things. If they sleep with a lot of men, they're called all kinds of names, but men are cool, they're the man if they do it. So I feel like the responsibility for just making sure you're safe and everything, ultimately I'm going to promote that we should, as women, make sure that we're safe, make sure that we're the ones, birth control, condoms, all that, because we can talk about how men are, it's a double standard, but at the end of the day, it could take years. We don't know if it's ever going to change. So we have to take the responsibility at the end of the day.
Exactly. And I think that's why for nurses, our voice needs to be promoted on our podcast and similar podcasts, because to that point that you were making, so with her coming out with Shaq, being spotted on a date with Shaq, people in social media, they were like warning Shaq, oh, do you know who you're dating? And all kind of memes going around like, bruh, do you know who this is? And, she's been with the team. Well, who has Shaq been with? What does his sexual history look like? So we can speculate. And he himself has been forthcoming in terms of his relationship with Shawnee to say, I was the one that messed up that marriage. That was a good woman that I had. I was the one that messed up that marriage. I can't put that on her. I was out there bad. And I think he says specifically, I was the one that was not honored, taking those vows seriously and honoring those vows. So, and I absolutely commend him for that, because, when relationships fall apart, women get drugged through the mud. Well, what wasn't she doing? What did she not do? And so just from them being spotted on a date, now it's like, oh, you better warn Shaq, do you know who he's going out with? And it's like, he's been in the NBA for how many years? So we could assume
a long time. Mm-hmm. Right. Is anybody warning her?
Exactly. Where are her warnings? But it's like the stigma falls on the woman, just because she's been candid in terms of how many people that she's had sex with. And it has been open about it. So now the stigma is on her, and warn the men. Seriously? Who's out there probably worse than her? We don't know, but right, I'm saying,
right. Allegedly.
Yes, exactly, allegedly. But in general, like, men right. can, because it's accepted in society for them to be sexually promiscuous, it's no big deal, so they can have numerous partners, and that's okay. But now when it comes to a woman being vocal about the number of people that she has, now all of a sudden, we're branding her with a red letter.
But do you think that will ever change? Look, from the time we were in high school to now, all the things that have changed with what's accepted, so much inclusiveness has changed, right? So I wonder if years from now, the men are going to look as bad. Are they ever going to have that reputation? I wonder about that, because things have changed so much, of things that were not acceptable before, and now it's open, so I'm just wondering if that would be something I'd like to look at, in the future, if I could
Yeah.
zoom into the future to see if that's ever going to change, or if that's something that's been around forever and will always be like that. Women, the double standards between women and men, because
Mhm.
that's one thing that has not changed.
No, no. I can see it kind of improving, but I don't see it actually getting better. I think women will continue, and I like that women are owning their voice in it. Not that she had to reveal her number, but if she felt comfortable enough doing it, that's her business, and she shouldn't be shamed for it. Similar to like Amber Rose, and she had a walk that she was doing. I think it's Slut Walk that she was doing out here
Yes.
in LA, in terms of women owning their sexuality and you know, kind of embracing who they are and not, you know, uh, let's not label people,
Right.
or let's
Right.
label equally if we're going to do that.
Right.
Yeah, so I just thought it's kind of like what I wrote here when I thought about it. It's like a cultural groupthink for this generation, you know, just in general in terms of sexual behaviors and how we think of people. It's definitely just kind of like a cultural groupthink. Everybody's thinking the same and just quick to label and jump on the bandwagon. I think this generation is doing more. And then for, you know, people of our generation that we've lived a little bit longer, we see, okay, that's not so bad, you know, and we can guide differently.
Right. Or you can be accepting to people change. You know, what you did then is not necessarily who you are now. What you did
So
in your
when do people
college.
learn that lesson? That
Mm.
what's your how do we teach people that lesson that people change?
I mean, I think it's just the more they hear and the more that you talk about and educate how life changes. You can be in college and be on Girls Gone Wild, and 10 years later, you're married with a baby, and you look back and kick yourself for what you did in college because it's, out there now. And I think, honestly, I think it's the parents have a lot to do with it. You know what I mean? Parenting, mothers telling their kids, not coming down on them, but talking to them so they could be open and feel like they can talk to them about things. But, just letting them know who you are today is not who you're going to be 5 years from now or 10 years from now. But what you did on the internet or what you did on any kind of video will stay around. It will, once you have a reputation, it doesn't go away.
Mm-hmm.
So you will have to correct that over the years. You know what I mean? So it's okay. So I just feel like, the to me, when you're young, especially young women, you're really in an impressionable age when you're in your late teens, early 20s. So I think that time frame as a parent, for you just to explain those things and try to reiterate that, over and over about what they do right now and how it'll affect them long term. Because I feel like everybody can change, and I think we should be open to it. We all should. I don't ever feel that women should be posting negative comments. I see a lot of negative comments, and it really hurts my feelings as a woman to see another woman. We get it enough from the men. You get it enough from the men, and you can totally not agree with their lifestyle, and you can say, you can be better than this. Try to promote them, because people aren't going to change without support. People aren't going to change unless they know they have people behind them. Some people can get into a mindset of, well, I've already done it, there's no going back, I might as well just keep on.
Mm-hmm.
And so knowing that there's groups out here, and there's lots of people that will accept you for you changing. It's much like a person who never went to church,
Mm-hmm.
and they found God,
Mm-hmm.
and they get accepted. They
Mm-hmm.
don't say, well, what did you do? A lot of people do at church, unfortunately, but we're supposed to erase the past. Only God can judge, right?
Mm-hmm.
So I just feel like we need to have that forgiveness and open-mindedness. Open-mindedness is the biggest thing, I think, for all of us to say a person is not defined by their past. A person is who they are as of today. Their actions and what they do now are what speaks of their character.
Girl, that's a word right there. And man, I'm just taking notes as you're talking because, like, and if you think about it, even like with R. Kelly, people were still willing to give R. Kelly a pass. They needed the tape. And we saw the tape. Remember back in the day, we saw
Oh yeah.
that
And
first.
then everybody's like, is that really him?
Exactly.
Was
We
she
just could
really
not,
13?
exactly. We could not wrap our mind around the fact that this would be him because of who he was as an entertainer.
And
And
because that album came out,
was it 12 play?
no, when that video came out, I remember, wasn't it the Ignition, like, is the remix to Ignition? We were like, oh, I like that. Oh, I don't am I supposed to like that? Oh, this video sound.
Exactly.
I'm
But
like, please let this not be true, because I like this album.
exactly. But it was literally just kind of glossed over, and part of that was the gender because he was a man and absolutely because he was a celebrity. So again, when you're talking about that we're not defined by our past, it's like in this one, social media is in ink. Everything that everybody is doing is in ink. And so for this young generation, we're trying to tell them, be mindful of what you post, be mindful of what you're tweeting, because people are coming back. That young lady at Vogue, she lost her job because of a tweet that she had made about Asians, several years ago, almost a decade ago. And now where we're in this anti-Asian hate movement, now you've kind of like shot yourself in the foot for a tweet that, from decades ago. So it's almost like, with all the diversity, equity, and inclusion and, us wanting to be open about people's experiences and who they are, not to judge, considering things, the more we're like that, the more we're not with social media.
Right. And we may all be like that in public forums, but when you're behind a computer typing things and commenting on things, your true character shows.
Yes. And the trolls, the people who troll just to be trolling, that level of ignorance and wickedness there, because some of the comments that they make are just absolutely cruel.
They are. And it's, I don't even I stopped looking at comment. I don't even review most of the comments when I look at articles and things, because I feel like I can post my own opinion on things, and I can look at things from, I like to hear both sides. I like to do a lot of research before I even come to any type of conclusion on how I feel about something.
Right. And people are doing that.
Right. Before you take a stand on something, make sure you have the correct information and it's multiple resources, and you're looking at the pros, the cons, the people that are against it, for it, and really, make sure that what you're if you're going to put it in writing and what you're going to stand on is accurate, because the worst thing you can do is stand on something and find out later it was from a false source.
Yes.
And then you're looking not so credible.
Yes. Yeah. And it's the hypocrisy for me, because people, they're very critical of things that are, that are maybe occurring in someone else's life. Oh, I would never. But what are you doing? That's the question I want to ask you. You would never this, but what are you doing? Because sin is sin. There's no hierarchy amongst it, among it. But, people are so hypocritical. And if they're doing something similar or worse, now they want to nail somebody else to the cross with judgment. And that's what it was so off-putting, is that, and the women were the most judgmental, that sisterhood component that you're speaking of. Like, the women were coming for that girl's neck worse, when she came back and had this epiphany that, hey, how I was living and what I was doing wasn't the correct way.
Right.
Put each other down like that.
No. And I mean, I would think that everybody would be overjoyed. That is great. That is so good that you found your way, that you recognize this. I mean, that is, we're here to support, keep up the good work.
Yes.
Keep up the good work instead of tearing it down. That's not what I think is becoming of any of us.
No. And another thing that you said when you were talking about how are we raising our children and guiding them, we could definitely have a discussion about nuclear family, mother and father in the home, and especially that father-daughter relationship, which for me, until I die, will always be key. I don't think that you can circumvent, we don't want to swerve off into, kind of the same-sex households. That's a different podcast. But for this discussion in terms of that father-daughter relationship, and in particular, because Brittany brought it up, she said that she was raised by her grandparents. In the beginning of her life, she didn't really know her father, and her mother was there, but her mother was kind of in and out of her life. But it was really her grandparents, but she missed mom and dad. So, and because she didn't know her value, didn't have that father there to guide and to kind of pull her card and, to say, okay, this is what's acceptable behavior from a man. This is what you should tolerate. This is how you should comport yourself in this setting. Or, as a man, I'm telling you what they're thinking. I mean, we've had, fathers in our daughters' lives. So we absolutely understand that important role that they play. And for her to not have had that and to now made the decisions that she did, why are we now still sticking knives in her back and trying to crucify her? Because she came to a realization, a good realization.
Right. And it took her longer because she wasn't raised with that, So, I mean, it's remarkable that she's been able to change in her views without that. And just from having a teenager and her relationship with her dad and how he is so involved with every sleepover she goes to, every dance she goes to, or whatever, of, saying, you got to watch out for this, that, and just saying from a man's standpoint, because that's one thing as women we can't do. We will never have the mind of a man.
Right.
And so that's what's important. And so, I commend all single mothers for having to put in double the work to just really, really educate their daughters when they don't have the fathers. And so that's a whole nother podcast.
Yes.
But, it's real important. And when there's that lack of a father involved, sometimes you do make the wrong decisions.
Yes. And even when he's there, you can have a dad there, but as you're growing into womanhood and you're experiencing different things, like, you can hear daddy's voice, but you may have we all make mistakes in life. And so it has to be that opportunity to be forgiven. But it really, for me, like, you had your dad, I had my dad in my life, and, they were there and to provide guidance. And so my heart, like you said, it really goes out to these young women, these young girls who do not have that father, because that bond matters the same way with mothers and sons. Like that bond matters, and you can see how the sons are going to act by how they treat their mother, and really the daughters as well. Like, how savvy are they and how are they able to navigate? Kind of like with Lori Harvey. Because will say, she says, she's got Steve Harvey as a stepfather. And she said, I have 4 or 5 brothers, 2 or 3 brothers, a number of brothers. So she was like, so I know the game. I know how men think. I know how y'all operating on. And so it kind of dictates how she moves in life and how she shows up in spaces. It matters.
It does. It does.
Yeah. So with Brittany not having that, and like you said, her now having to figure it out on her own, it absolutely factors into the decisions that they make, that people make. But for us young women in particular, and focusing in on her because she was attacked, again, like, watch out for her, just utter foolishness. But what I wanted to do is, what I was thinking here was like, what did I put here? Sexual expression, practices, beliefs, that all factors into our parenting and how we were raised. Now, what nature versus nurture? We're not going to go into that one. That's a different podcast.
That's along with evolution.
Yes. Yes, because it goes into that. But like safe sex, can you talk about safe sex practices?
Well, safe sex practices to me are nowadays, a lot of it is taught in the schools.
Yeah.
We would hope that everybody's family and everyone would be able to have those open conversations with their children about safe sex. I can tell you from an Asian mother, that was a no. It was just don't do it. Yeah. There is no safe sex. Just safe is just don't do it.
Don't do it. Right. Me too.
If you do it, you're just a prostitute. I mean, you're, so I grew up never having those conversations. And so it wasn't until I was in school to really even learn about those things, them talking about condoms. And it's like, and you're learning about it when you're in middle school most of the time, and you're just sitting there in class giggling because it's embarrassing for the boys. But as it does it does give you kind of a start. And as I got older, and of course, going into college and whatnot, the more education you have, you educated yourself. I educated myself. You have to be proactive in educating yourself on a lot of things, because a lot of us have a generation of parents that are in the boomer generation that are old school, set in their ways, and they're not going to change. And they're not going to talk to you about the things that you probably need to talk to. So it's going to be up to you to get out there. Our generation and how we talk to our children is way different, because I know that I've had all of these open conversations with my kids.
Yeah. And they still have a choice to make. And Lisa, that intergenerational wisdom that you bring up, like that's really a solid point, because a lot of times, you know, people, millennials, let me throw millennials under the bus. I'm gonna start that bus up and I'm gonna run them over. You know, they like to hold, you know, our generation and baby boomers, you know, kind of accountable, you know, to say that, oh, how we taught, how we was raised. But like for our parents, what you just said there with your mom, like sex education was don't do it. And, you know, similar for me, my daddy was Nigerian, you know, but that was how they was raised. Like these are, you know, their parents, 1920s, 30s, 40s, you know, that was the mindset at the time. And so if we're now trying to adjust and adapt to, you know, a daughter that's now saying, I'm, you know, non-binary, here are my pronouns, and mom is like, you know, give us that space, you know, and that kind of, you know, grace to kind of embrace this, because it wasn't what we were taught or learned. This is like culture shock for us. A lot of this.
It's a learning process. You can be open-minded and try to accept anything new that your kids are telling you, but it's a process to learn it. And as far as going back to the way our parents were, where we didn't have sex education in my house or anything, but you and I both know what was the result? What was the outcome of that? I had a baby at 18.
Yeah, I was pregnant at 17, baby at 18.
Okay. Yeah. So could our lives have been different? You know what I mean? If we had that education, would we have done things differently? I don't know.
Yeah. And that's a discussion, you know, and a discussion that we have, you know, with our, you know, with our children. We can look at ourselves and say, well, should we or could we have done differently? Yeah, definitely. Yeah.
I know so far with my 4 girls that I have a daughter that has 2 kids, but she was 21, you know, so she made it through high school and she had to take her time getting her degree in college, but she ended up doing it still. So she was up a level above me, you know what I mean? She didn't have that hard time going through high school and, you know, being pregnant your senior year and all those things. And so I was happy with that. All 3 of my other kids, they're birth controlled out.
Yeah. So see, and even the birth control, the fact that they're on birth control, because that's a whole nother discussion right there.
Right.
Put that down. I'm gonna take a note, because that's a whole nother discussion right there. Because in certain cultures, certain generations, you know, you weren't putting your children on birth control, even when they were sexually active. So it was, you know, what are we doing here? But segueing into that, when we're talking about sexually transmitted infections, according to the CDC, 26 million new sexually transmitted infections, STIs, in 2018. And it says half of the new STIs were among youth aged 15 to 24 in the United States. So again, in thinking about Brittany Renner and, you know, her being open about her sexual history, you know, this whole thing with Shaq trending just in general, you know, people, how do we keep people safe? Because clearly they are getting infected. And what does being safe look like? Like, in addition to condoms, what else can we do?
Right. I mean, limiting sexual partners, I think, is one of the biggest things. You know, when you have multiple sexual partners, you're putting yourself up for multiple risks. You know, so I mean, condoms are absolutely necessary, you know, but we also have to talk about limiting your exposure.
Yeah.
You know, so I think that's important.
And what about when signs and symptoms manifest? Because that's something that kind of keeps people in a chokehold, figure out, oh, I don't have nothing, nothing's happened to me. I don't have no signs and symptoms. It's not
Well,
me.
you and I both know, because we've done our OB rotations in school, even though we may not be labor and delivery nurses or OB nurses, we've done them. And women, now, don't get me wrong, there are some STIs that you have no signs. You might not know until someone tells you, if they
Yes.
are courageous enough to do so, or you happen to go in for a regular physical or something and you find out. But a lot of times, when something's wrong with your body. And it's your sense of denial that probably keeps you away from going to get tested. Like, I don't want to go to the clinic. I'm fine. I don't, I'm
Lisa, do
clean.
you think they do? What about these young teenagers? Do you think they know enough, or because I know the population you're talking about?
Yeah, I think now the young teenagers, I don't think they really know. I don't think they get it. They may, I can tell you, I did community health for a few years, and I case managed high risk teen pregnancies. And we had a lot of young girls come in, find out they were pregnant with their child's father, and also find out they have an STD the same day, or STI.
Yes.
When did it change from STD to STI?
I don't know that date, but it had me confused for quite some time because I kept saying D.
Yeah, we're old nurses.
They're like
STD, STI.
infection. I'm like,
Yeah.
infection.
But yeah, so they would come out literally and find out they were pregnant and be like, I'm so happy. And then come in and they would test positive for chlamydia, gonorrhea. And I would have them in my office and they would be so happy, even though they had the results of the lab test. And he's sitting right there and they're hugging and kissing. We're having a baby. And I'd say, so you know what this means, that you have this, and do you know how you get it? Well, he said he didn't have anything, so I don't know. And it's like, that's physically impossible.
Right.
Either he gave it to you or someone else gave it to you, and that's a conversation that you don't want to get into right then and there, because then it's, well, who's the baby's father, right? So you have to, it's really important to get women alone talking to them, because some things, like when they're with their partners, are not going to be revealed. And so you're not always going to get truthful answers, but and no man is going to, well, most men aren't going to sit there and go, yeah, I gave it to her.
Right.
Yeah, she just found out she's pregnant, but I don't think that they understand, because they're looking at me sometimes like, well, what do you mean? He said you didn't have anything. I don't know. Maybe that test is wrong. And, and so a lot of the young teenagers, they really don't understand, or when they're having sex with different boys that their friends had sex with, and all of them end up with these diseases, and they just don't get it. They just don't get it. And it's really important for them to understand that this is preventable.
Yes.
This is so preventable.
Yes.
And so it's really something that I feel like the word has to get out. And I mean, but the word's been out. I mean, we educate on safe sex. But again, if there's not someone in their life, if there's not someone within their household or anything really promoting and saying, here, take these with you, I'm going to stick these in your purse. Is it really going to happen? Are they going to be too embarrassed or shamed to walk into the convenience store?
Yeah. It's so many. I'm just thinking like the health continuum. So we have these young girls who we absolutely want to reach, but then our sex education as nurses can kind of be limited, like to the school nurse, and what is a school nurse able to educate on. And now we have, the interference of politics into this, in terms of, what do we want to teach our kids? And even if we remove gender, just about sexual health, because it was something that was trending on social media as well, where the teacher was explaining about something about pleasure, and I looked at it and I wasn't necessarily offended by it, but it ended up, she got suspended. And I'm like, well, how did they think she was supposed to explain this? So just kind of, it's just so many things that are factoring into, even for us as educators, what we can, tell, these young people. But I think if we thought about, like, with just in general, kind of like with Brittany Renner's age, young adults, in terms of knowing your body, knowing, what is normal to you, your bodily fluids, what is normal, your cycle. So that way you can spot when something is abnormal, a smell, and to say, okay, this isn't right. And then how do I now follow up on that and not ignore it, to where you're not coming in with, syphilis that's gone to other places, spread to other places and are in your eyes, or, these severe herpes outbreaks that have gone everywhere because you didn't recognize the signs and get treated sooner.
Right. Or now you're sterile and can't have children because chlamydia turned into PID, and now you're not able to have children because you let it go for so long. But not everything and not everyone understands what's normal about their body. So going into the doctor is the main thing, because it could be something as non-concerning as bacterial vaginitis.
That right quick. Can you just, because I was going to bring it up, but can you talk about BV really quickly? Because it's a stigma around BV to where people are making it like, oh, she smells like fish, and she's got the BV. This isn't a sexually transmitted infection.
It's not.
To the people?
It's not. It's a bacterial infection. And, I don't even know what causes it, because I don't know if there's one cause, because there's so many different things like yeast infections, the wrong type of underwear, the wrong soap, or
your
reactions, your pH. And so BV is something that has a smell, and the smell, like usually when it's not pleasant. So you want to go get checked out, and the treatment is Flagyl, or it's an antibiotic that you can take, and it's something that goes away, but it's not a sexually transmitted disease.
Yes, because I hear so many people talking about it, and even I want to go a little bit further, because it's boric acid that's over the counter. They have these boric acid suppositories. You can get them from Target. You can get them from Amazon. I think it's 600 milligrams. Insert that after sex. Insert that after a period. Insert that if you're smelling something. But be in touch with yourself. And that boric acid will take it away. Because you would have many women that would come into the ER that had, bacterial vaginosis, didn't know, and, would have these stories about, being shamed and behind it. And it's nothing to be ashamed about. You can go get over the counter stuff. And now with technology, Google it and see. But it's just such
easy on Amazon. On Amazon, you can find all that. And the boric acid is if you can do that after, like you said, after a period, after sex, or anytime you feel like the beginning stages maybe of something being off, right, you can insert that and prevent it from developing into something that you need the antibiotic for. And so I think it's, great, but I mean, and same with yeast infections, knowing that, the beginning, you don't want to wait until a yeast infection is just out of control. Not only is it unpleasant and uncomfortable, but it's harder to treat. Instead of doing the 1 diflucan pill or going and do the 3-day, you might have to do the 7-day, And so, it's really, at the first sign of something being abnormal, going to your doctor.
Yeah, definitely.
Yeah, figuring it out.
That preventative care component, that's key. That's why we're here, is part of why we're here, is to encourage people to engage with a doctor, just to check your blood pressure, for women to go get pelvic exams, especially, well, if you're sexually active, you should have one, but to go get checked out and let's see what's normal down there, knowing your genetic history, your family history, and what runs in your family, what are people dying from? So that way, I don't know, Lisa, at 18, I was very connected with my body. And, I remember they were trying to push, remember what were the rods? Depot?
No,
Norplant.
Yeah, Norplant.
Remember, that was very popular. That in Depot, that was very popular. And I don't know if you remember, but you and I one time we talked about it, because everybody at the hospital that we worked at either had Norplant or was Depot. And it was kind of like, that was the lick. That was the thing to do. And I just remember thinking, I knew I wasn't getting nothing in my arm, because they could not tell me how are you going to get this out?
Right.
And even not having, at 18, not having a nursing knowledge, I'm just like, skin is going to grow over that. Like, how are you going to take this out? Like, it didn't
Right.
make sense to me. But remember one time you and I were talking about like birth control, and I was like, oh, I'm on depot. And I said, I'll never do it again. It dried me out horribly. And you said, it took away my sex drive. That was the birth control.
Yeah.
But for us having these open conversations, that
Mhm.
is what, like, and I'm like, really? And I was like, well, girl, this was what I was experiencing. And I'm like, never again. But now you can go back to your doctor and say, this didn't work for me for whatever reason. And like, again, with that Norplan, I don't know if they're still doing that, but IUDs, how do they come out? What are the complications? But to ask the questions.
Mhm. Yeah, and knowing, now how IUDs, how they have the Mirenas, the different type of IUDs that have hormones and different ones, how small they are, what are they, copper, what are they made out of, just having those discussions, and how easy it is to take them out, how hard is it, getting all of that education, I think and then you can know what all of your options are, because there are plenty of options nowadays, so many different ones. It's just a matter of what's your preference and what's going to work for you the best.
And with this direct to patient marketing, I mean, how many times do we turn on the TV and they're like, ask your provider, talk to your provider about. So they're putting the burden on us as healthcare consumers to now have some knowledge of what it is that we want even before. That never worked for me though. If I see a new allergy medicine and I would take it to my doctor, she'd be like, what's working for you is fine. We don't need to change. And I'm like, TV ad said, talk to your doctor. I'm trying to talk to you. But my doctor was actually very cool. I loved it. And so, but yeah, it's like the onus is on the consumer now to kind of know what they want going into their primary care provider. But my thing is just get there. Like, I don't care if it's a clinic. I don't care if you have to stay all day, just get established somewhere so that there's some medical record on you and there's something to compare, a baseline to compare, for your health. It's important.
Yes, you have to. And if it's something that you forget to do, the important things are a mammogram, a pap smear, or a pelvic exam. Because I think pap smears are now like every 2 to 3 years that they're requiring instead of a pelvic exam every year.
Yeah.
And a physical. If you remember the month of your birthday, I remember the month of my birthday, I schedule all my things because that's what is going to make me remember. It's going to make me remember. So if you just put that in your mind, like, okay, it's my birthday month. Not only is it the fun time, but okay, this is the month that I need to get all this stuff done. That way you won't forget.
Yeah, that's definitely a good idea. And then also too, like you mentioned, like, these diseases, you can actually have a disease. We should know that about like HIV. Like, you can have a disease and there's a latent period to where you're infected with something, but the virus is proliferating. So you may have either non-specific signs and symptoms or no symptoms as it's still kind of proliferating and shedding within you. And so, you're able to infect others, and so just because, I don't have anything, I don't have any symptoms, I don't feel like this is a language we should be using in 2023. Even if you're not an educated person, you have a phone and you have access to Google. And so if somebody is saying to you, I think I've tested positive for this, I think it may have come from you, that's a serious question, a discussion, and for you to go follow up on it and go get some help and look into it.
Absolutely. Yeah, absolutely. I mean, that's a gift if someone tells you that,
Right.
because most people are not going to say a word.
Very true.
Very. So you can take it in an offensive way, or you can say, thank you.
So looking out. Thank you.
Thank you. And
Yeah.
I'll go check out. So hopefully you don't have anything, but the fact that they cared about your health enough to say, I don't know if it was from you, but I know we had sex. So you might want to get checked out because this is what I had.
And I think too, with HIV and herpes in particular, these two in particular, not a lot, but some of the stigma surrounding both of these diseases, I think, is diminishing a little bit, because for HIV, it's unfortunately so prevalent within the community, but with Magic Johnson and his survival and, being the poster person for HIV and what survival looks like, and a good one, I think he's helped to decrease a lot of the stigma surrounding HIV. And again, because the numbers are going up, and then the medications, the therapies used to treat it can eradicate the virus from your body in terms of it not showing up to you, now transmitted to someone else. I had a person tell me one time that was a rep for an HIV med. She said, no one has to die AIDS. No one has to die AIDS in this day and age. She said, because the medications, they will take that viral load down to undetectable. So knowing that, and the same thing with herpes, is that, again, it's a virus. It can be taken down to where it's undetectable, still here in your body forever, but you're just not, it's not there and not producing. I had a young gentleman come in one time, and herpes was everywhere, like literally in the eye, in the mouth, genital. And it was some stigma around his sexuality, and he had PPO coverage. And I went and I told him, I said, sir, you have the best coverage, go get connected and go follow up, and had to talk to him about HIPAA as well. This is your medical record, to where no one can inquire and call like, hey, my so-and-so's there. Can you tell me? No, I said, don't let these things get this out of hand.
No. And same with therapy. Some people don't want to go get therapy because they don't understand that due to HIPAA, that information is private and it cannot ever be shared with anyone. And if it ever was, you'd be a very rich person.
I'm telling you.
Because you can spoil the whole organization.
Exactly. I would honor my jury duty requirement to come sit on that case. Like, oh, what? This is what we're doing? We tell people, because some of these clinics, that's another thing excellent point that you brought up. The privacy of the clinic is not, people's privacy within the clinic is not maintained. They just blurting it out. Even I checked in one time, and the woman was asking me about my sexual history. And I'm like, ma'am, I think I got gout in my big toe. Like, my big toe is on fire. Like, my joint, I don't know that this has it. And you're talking so loud. Like, and I'm literally sitting, we're about this far apart. And I've gone to clinics, especially in rural areas, underserved communities, to where that professionalism is not there, and people are just broadcasting names and diagnoses and age. And it's like, how y'all living? Then you wonder why nobody wants to come here.
Right.
And it should be for Medi-Cal patients, anybody that's getting paid. You're going to get paid at the end of this encounter. So
right. You gotta be careful as people in the medical field that are working. When you enter an elevator and you're talking to your coworkers and y'all are laughing about other people around, you got to zip it.
Exactly. Yeah, because this is what contributes to that. Well, Lisa, in our final few minutes, I guess just to sum it up, let people live their lives. Brittany and Shaq, we don't know what it is that we're doing. We haven't seen him on a date since, and he's actually slid into the young woman's DMs at Home Depot. So he's on the move. She's doing what she's doing. People are living their lives. But I definitely thought, when we saw this story, you and I talked about it, and thought this would be an excellent opportunity to educate people on sexually transmitted infections, preventative care. And I think we've done that. If you had any final points, what would you say?
I mean, I think we've covered most of it. I think the biggest takeaways from it are making sure that you're getting preventative care. If, make sure that you have a month designated out of every year that you're going to take care of you and preventative health. Don't wait till there's a problem. Actually prevent anything, and be safe. And it's on you to protect yourself. It's on you to get the birth control, the condoms, and all those things that when we're talking about these things, and making sure that you're being proactive in taking care of yourself. It's not going to be up to the man or your partner or anyone else. It's you.
Yeah, definitely. And that child is going to fall on you, and childbearing will fall on you, in the future. Because as you mentioned, like with chlamydia and how it can lead to sterilization if we're not, checking ourselves. And just really quickly in these last few minutes, this is why this is so important. That young woman, that teenager, I think, that delivered that baby in the trash can at the hospital, and then she threw it in the trash can, and now that, I'm gonna have to follow that case and see where it's at. But the mother came at the bedside and was like, she didn't even know the young woman was pregnant. Now, when we were looking at some of the photos, it was obvious that she looked pregnant, but I would just encourage, young people in general, talk to somebody, because the outcome is not, everything is a discussion. Like, let's talk to somebody. And even if you don't feel comfortable talking with your parents, there are clinics at the school, like you mentioned. Hopefully there's somebody in your life that you can kind of open up with on some level to reveal what's going on with you and face reality. We Asian mother, Nigerian father, if we can go home and, and from that country, like not like us, second generation, but literally from, Vietnam, correct? Mom's from Vietnam, dad's from Nigeria. But if we can go home and tell our people that we're pregnant, I feel like anybody can go home. Girl, anybody can go home, but talk and let's tell people what's going on.
Absolutely.
Mm-hmm. Okay, y'all. Well, this is another wonderful episode of the Two Bad Nurses podcast. We're signing out. Until the next time, you all take care.
Take care, everyone.